Darcy, do you have that big of a problem?
No, I don't think we do. Maybe I'm just naive, but our city of Las Vegas is quite small, and we have a really great enforcement team. I think what we found was medical marijuana was allowable since the year 2000, but it was really for home grows. And what would happen is kind of what Kat said is they would grow at home and they would find a location like, I don't know, like a botanical place or where they sell like candles and whatever. And they would come over and they would try to sell it to them, or people would come together and they would create what they call like a co-op, and they would share their marijuana. Our enforcement team would go out and they would find that, they walked in and there was already a case, like a glass case with price tags already on it, and they were running as a dispensary. We have a really great relationship with our police department, and our enforcement officers would just kind of go through and do the regular inspection, and the other officer would go outside and make a call to narcotics, and they would come in and they would shut them down. So we saw a lot of that in the early 2000s through until we got the 2014 regulations passed. And since then, we haven't had too many problems. There have been cases where they found illegal drugs, and again, we work with our metro to get them off, but we don't have a lot of thousands of unlicensed businesses. I think pretty much anyone that's selling, growing, producing marijuana in the city is licensed. There's probably a really tiny handful of, of the criminal element that's out there. I think we've done a really good job there.
Well, and that sounds like a real challenge for LA. What we had in Denver was a lot lesser of a challenge. When we legalized in 2014, our city council put into law that we would prioritize, let the previously existing medical marijuana businesses that were up and running, we let them transition to retail marijuana first. But we still weren't sure who was licensed, who wasn't licensed. Some might have a license from the state, some might have a license from the city, but not also from the state. Some had a zoning permit and they thought that was their license. So we got together with all the inspectors, and our inspectors rode around and we inventoried all of these different businesses that were out there. And we wound up with 175. As opposed to thousands, So that was sort of early January, right after we legalized. We had 175 businesses. We drafted form letters. Dear business, you have a state license but not a city license. You have a city license but not a state license. You have nothing. And we told them you need to be licensed or cease operations by July 1st. So we gave them 6 months. In that letter we said, we'll walk you through it, and we will have these 3 different permitting workshops, and we'll help you, and we'll do all this stuff. And by the time we got down to January 1st, we had a number of them had dropped out and could not get licensed because they were maybe too close to school, or they violated area restrictions. Or in Colorado, we have a prohibition against people working in the industry with certain types of convictions, criminal convictions. So maybe they had a criminal conviction, so they were not able to work in the industry. And went through and ultimately got all those people either licensed or out of the business, so we could then start in January with a firm regulated industry, which we feel like then, right, incentivizes people to get licensed. Licensed people who are being subjected to the fire department coming in or other stuff doesn't like it when they see the guy down the street who doesn't have a license and isn't paying taxes and isn't having to conform with everything else. Now looking back on it, we know that we lost a lot of operators who had been operating for years. That maybe if we were doing it differently now, maybe we would have done something different. We did try to help as many people as we could clear those hurdles, but where we couldn't because of state law, we just couldn't. Any other comments on that piece?
So I just want to add, because I'm looking at one of my friends from LAPD who's standing in the back, so I'd be remiss if I didn't say that we work, even as a licensing and regulatory agency, very close with law enforcement. And because we have such an issue with the proliferation of unlicensed operators in the city of Los Angeles, we're really trying to reevaluate even how we go about reducing those number of operators. And so one of the things that the city council, particularly some city council members are looking to do is to really try and move LAPD, if it's not what they consider to be significant criminal activity, out of the enforcement role. We have had council members who are suggesting and we're moving forward with policies that would disconnect utilities at these facilities, because it'd be very difficult to cultivate cannabis if you don't have access to water or electricity. Where we have council members who are interested in padlocking, using building code to padlock facilities, to actually lock operators out. But again, getting away from kind of heavy law enforcement unless circumstances really call for that effort. But I appreciate the partnership that the Department of Cannabis Regulation has with LAPD and our other law enforcement agencies as we try and tackle what will be a difficult few years as we try and transition.
So I'll ask one more question of the panel members, and then we'll open it up for questions for all of you. And just my one big, general, broad question, and Brandon, maybe we could start with you. I hate this when people ask me this question, so I'm enjoying asking it to you. Has legalization been a positive or a negative for you?
It's been positive. Yeah, I mean, if you look at the amount of cannabis sales that's now taking place in our legal and regulated market, where we can track it, where it can be tested, where we know the buildings are safe, where the tax money is going to help very important efforts, for example, in the city of Portland, to help people clear their records and get workforce development. When you look at the infrastructure improvements that have happened in our neighborhoods, when you look at the decriminalization of cannabis and how law enforcement can now focus on more important priorities, it's been an overwhelming positive. It doesn't mean that it's been perfect. It hasn't been. Again, you know, we've made plenty of mistakes, and I think the important thing is to own it, to continue changing and continue adapting. But yeah, to me, it's a very clear positive for our community.
Great. And Darcy, you being a little bit more new in than some of us?
I would agree. It's probably been more positive than negative. The revenues that it's brought into our state and to our city is astronomical. It's insane. I didn't realize how much money was going to be there. The fact that, as Brandon said, that if people are going to do this, they may as well do it in a safe manner, that we have actions in place that we can look at the public safety, make sure that they're tested, and make sure that the regulations are in place, that people are buying this in a trusted source like the alcohol. Yeah. It's more positive than negative.
Joe?
I completely agree. So I think there's actually, it can only be better, right? You all have cannabis in your community, whether you have a legal cannabis industry or a cannabis industry, quote unquote, that is kind of operating illicitly. You all have cannabis in your community. So really the questions is, do you want it purchased and sold through licensed entities that are going to do things like check IDs? So from that kind of public health, public safety perspective, regulation can only improve the situation in terms of access to cannabis for young people. It has what I would call a tangential benefit of tax revenue, but we really only had nowhere to kind of go. But there are consequences to cannabis, absolutely. Those consequences currently exist within our communities and have existed within our communities. I don't think we've been talking about them as openly as we have. We're now getting also more science around why young persons shouldn't ingest cannabis. But really the conversations around the hazards of cannabis have been lacking, but the regulation of it only improves public health and public safety.
Kat?
Yeah, I'll echo what my colleagues have shared. Positive, but not perfect. I appreciate that cannabis legalization regulation has forced leaders to be attentive to communities and to industries that probably weren't receiving any attention before. It's allowed us to have very intentional conversations about criminal justice and social justice issues. In the state of California, folks are able to have their records expunged and their records cleared based on the new provisions of law. We have a community reinvestment fund, tax revenue going towards communities that have been impacted. We're starting to see first in time real information. If you're a cannabis consumer, prior to Proposition 64 passing, you probably had no idea what was in the cannabis that you're consuming. There are now mandatory reporting of potency. and in various concentrations, businesses for the first time are having legal protections and don't have to face and kind of experience what it has meant to operate in an illegal market. And so I think that we're making progress. And if we started at prohibition, I think that there's a lot of progress that's been made.
So in Denver, I think, I still am always, there's so many pros and cons, and there's always still so many things we don't know. That's why I'm usually so hesitant sometimes to answer that question. I would say that, revenue's up, but that wasn't the reason why we legalized. But revenue's up, crime's relatively stable, and we have not seen a huge increase in youth usage, thank goodness. And in fact, our most recent Healthy Kids survey showed that our youth usage decreased over the last couple of years. But one of the things we do have a concern about in Denver is illegal growing and what we're calling home grows. And we are seeing, because, right, it's legal to grow at home now, we do have parameters around that, that people are not following. And they can, in Denver, hide in plain sight. They can go purchase their equipment to grow marijuana, and no, it doesn't raise a red flag for anyone. What we've always thought from the beginning, that the implication of a legal market does not mean that illicit market would just poof and vanish right away. We've still got work for us to do around that, which is one of the reasons why we've used some of the marijuana money to hire additional law enforcement officers. But I really do think, when you think about it, for years and years and years, arresting the marijuana drug dealer and another one will replace them. Arresting drug dealers, we know what happens. They go to jail and somebody else new replaces them. But if over the long term, we can take that customer and bring that customer into the regulated market, then we can help to start getting rid of that illicit market. And that's where I really see the real benefit. As I like to say, we don't go buy gin from our neighbor's bathtub anymore, because we can go down the street and we can get our particular brand, and we're not going to get arrested doing it, and we know what we're getting. And now hopefully that's what the regulated market is doing with the safety and knowing that the product's tested and knowing what you're getting, that ultimately over time it will help diminish that illicit market.
I think if I could just add, that's really important, I think, point to me, is that we tried prohibition. We tried maximum enforcement. It didn't work. Unless the goal was to put a lot of people in jail and prison, then it worked, right? But if the goal was to get rid of cannabis, it didn't work. So we tried maximum enforcement. We made it as illegal as it could get, and we still all have cannabis in our community. And so for me, this is really like, okay, let's try something different. Let's try economics and create markets for this that have structure to them and provide things for public safety and public health. No one gets to ban
That's what all of you
cannabis.
guys get to do over these next couple of years. So we'll move into questions. I see Macon. Do you have a question for us?
So for cities that are new to marijuana regulation, for cities that are early in the process, one of the most impactful and important decisions they'll make is to how many marijuana stores will they have in their town. And there are bookends to this. When at the same time that Denver had 175 licenses of medical that were transitioning to recreational, Oakland, California had chosen to limit the number of licenses for medical marijuana to 4. So those are kind of bookends. But I'm interested to know if the cities represented up there have found any principles for making a decision about how many marijuana stores there should be, have been successful. What do you think of when you're embarking in new regulation and you think, how many stores do we want or need in our city?
That is a great question. On the 13th of this month, I'm actually appearing before council to begin that conversation. So we have 30, we're a population of 500,000 people. It's like 1 to every 16,000 people. I did a quick survey of other cities in California and others, and there's no kind of roadmap that's kind of your number. I think each community is going to have to figure that out. My advice would be to, you can always add more, but again, you need to have the market needs to be accessible to the consumer. So you're gonna have to really evaluate that within the community. Our 30 dispensaries haven't been problematic, and we're gonna have a conversation around adding a few more.
Well, I guess the question following up on that is who here has caps on the number of their licenses?
Yeah, so in the state of Nevada, the state's the one that actually regulates how many each jurisdiction gets, and I think it's actually worked out really well for us.
Do you have a cap?
Sure, so we have what I like to call a soft cap on the number of licenses that will be issued. The city council decided that there were 3 areas where we were going to put this soft cap: storefront retail locations, cultivation facilities, and manufacturing facilities. When it comes to retail facilities, the ratio that the city council went along with was that we would allow for 1 retail facility per 10,000 residents. With about 4 million people, we could see 400 storefront. Soft cap is that once the department were to issue that specific number of licenses, we have a system that would allow city council to allow for that number to be exceeded. So right now, again, we have 169 of our existing businesses that have been able to transition. But even with 400, if we move forward with 400, that would still be a reduction in the number of facilities that are actually operating in the city when we consider the unlicensed businesses.
We don't have a cap, but there are no cap, but there are a couple forces that will artificially limit the number of licenses. The state has a 1,000-foot buffer from schools for retailers, as does the city. So that limits your siting. Then the city has a 1,000-foot buffer between retailers. So that's above and beyond the states. That limits the landscape even more. Then you have zoning. So in the city of Portland, a retailer can't be in a residential zone. And then, of course, you have, the free market at work. So, again, in Portland, 150 retailers, a town of 580,000 people, more retailers than we have Starbucks or McDonald's. But there's no hard cap.
Okay, next question.
My name is Ali, and I'm with the city of Santa Ana in Orange County. And I was curious, after hearing a lot about the regulations from some of the other cities in California and outside of California, what, if any, measures are you taking to engage economic development and economic development staff or tools or resources, if that's even on your kind of agenda, to kind of take it beyond the core of just cultivation, distribution, manufacturing, testing, and retail, and elevate it to the next level to, bring in the ancillary supportive industries and really create like a hub and an economic cluster in your jurisdictions?
Does anybody want to take that one?
Sure. Yeah, the city of Portland works with Prosper Portland, which is the city's economic development agency for small business support and workforce development. And we've also been cultivating relationships with Travel Portland, and particularly in Portland, when you're thinking about, again, the prospect of social consumption on the horizon, that's going to be another opportunity, not only for cannabis licensees who want consumers to consume on their licensed premise, but also for people who might have a venue who don't want a cannabis license to sell cannabis, but want to invite people to their venue. That may be a way for people with less capital to engage with this regulated industry. So those are some of the things that we are doing.
Anyone else?
I would just say, just to add on to that, we're not working directly with our EUD staff, but the next level for us is that social use venue, and I know that we're having that discussion tomorrow, but the city of Las Vegas does have a draft ordinance out there for public to comment on. We are going to try and get to that next level where we're calling it, instead of a consumption lounge, a social use venue, where they sort of dictate what the business model looks like, but they're going to be allowed to consume cannabis at the location.
I would say from Denver's standpoint, when we first started in 2014, Molly and I did engage our Office of Economic Development, but at that time, they were really concerned about engaging with us because of, being new and being first, and there was always that worry that if they did anything to help, marijuana businesses, that could jeopardize their federal funding. But we now have them at the table with us, and we're having conversations. We would like to see and be able to, continue to foster innovation and agility in this industry, and we need their guidance. We're going to be doing a study, a study pretty soon Our chief economist will be doing a study, looking at the market conditions, and looking at where there may be opportunities for ancillary businesses supporting the legal marijuana business. All right.
Thank you for taking my question. It's around social justice and social equity. We've seen that marijuana convictions have disproportionately affected minority and underserved populations. So I'm just curious how your cities have addressed or attempted to remedy these issues. Thank you.
So we're going to have a breakout lunch meeting on that on Friday. Are you signed up for that?
Yeah, I'm signed up.
Good. So we can talk about that generally high level. Does anyone want to take that?
So the City of Los Angeles does have a social equity program, and this program was largely born out of a real understanding that there was a need to acknowledge and address the harms that primarily low-income and minority communities experience by way of cannabis criminalization and the larger war on drugs. The way that this program has developed thus far is there's an intention to identify folks who meet program criteria within the city, folks who are low income, live in disproportionately impacted areas, high cannabis arrest communities, or actually have nonviolent cannabis convictions, receive priority processing and other types of technical assistance. Part of the challenge, just as there are challenges with launching a licensing and regulatory program, we experience real challenges in launching our social equity programs. Fortunately, Senator Bradford's 1294 was a piece of legislation that would provide state funding for local jurisdictions that have social equity programs. So now there's $10 million on the table for jurisdictions in the state of California that have these programs. And thus far, it's focused on licensing. I think that that's kind of the first step in this process, because that's, as a regulator, that's what we're primarily responsible for. But I think that as these conversations continue, we'll see the conversation around social justice and social equity extend further into how do we reinvest tax revenue into these communities, how do we ensure that folks just, not just having access to a cannabis job, but that folks have access to all jobs. People who consume cannabis still have issues getting jobs, and so the intention in the larger scheme is to one, recognize that community members have not been treated the same in the past, and that with current and future cannabis policies, we have an opportunity and real responsibility to ensure that the cannabis policies and their enforcement don't have anything to do with where you live or what your income is or the color of your skin.
Yeah, I mentioned earlier that the City of Portland just began its social equity program, and I'll embarrass my colleague Jeffrey Van Kent, who did incredible work on that. So that does provide support in the form of a license credit to small businesses, to those who have owners or staff who have cannabis convictions, and businesses who work with minority and women-owned emerging small businesses. The City of Portland also sets aside a portion of its local tax for record clearing, for expungement, for workforce development, and then broadly, the best way you can get people who are traditionally involved in the cannabis industry is to lower the barriers to entry. So Portland just lowered its licensing fee for micro tiers. In the future, I talked about perhaps venues for social consumption can be one area. Perhaps, right now in Oregon, you can deliver cannabis to consumers, but only if you have a state license as a retailer. Perhaps there's a future in which you can have a third-party courier that can provide that service and be able to participate. So all of those are very much on our radar.
Anyone else?
We have a social equity program as well. I would describe it as a small business support mentoring center where persons either directly impacted by the criminalization of cannabis or from neighborhoods that were disproportionately impacted by the criminalization of cannabis that are either in the cannabis industry or want to be in the cannabis industry, that can go to this center and get help with all the supports and services that really any small business would need in order to be successful.
I'm not aware of any programs in the city like that.
So, and in Denver, we are moving forward with that. That was one of the phone calls I had with Seattle the other day. sort of with both of us being, up and running, and not having done that initially, it's where do we do, how do we start? We were just sort of making sure the sky didn't fall. And at the time too, when we first got started, we didn't know how profitable would this business be. Do we want to be setting somebody up for something that might not be successful? And then again, we had our Mayor's Office of Economic Development concerned about the whole illegality piece. So right now what we're doing, the mayor has directed us to move forward with vacating convictions. So we're working on that, the marijuana lower level charge convictions. And then we've got a work group that's working on looking at what are the opportunities, first around just reinvestment in communities with some of those marijuana tax dollars. We've already done that. I think the mayor mentioned we are using some of the marijuana tax dollars for our affordable housing fund. We've used the marijuana tax dollars to reinvest in neighborhoods and capital expenditures in some neighborhoods that were, we believe, disproportionately impacted by the war on drugs. And then the next part of that whole conversation is around the licensing piece, the workforce development piece, and what does that look like, and what's the best program for our community. So I can't remember who's next. Okay.
Hi, Heather Sumner, Deputy City Attorney with the City of Lansing, Michigan. As a fellow municipality going through this brand new process of regulating the industry, this panel hit home for me. One of the questions I have is we're already experiencing a significant level of litigation, and I was wondering if your community or your municipality was experiencing litigation, what have you learned from that? If you're not having a lot of litigation, what about your ordinance or your infrastructure do you think is keeping that at bay?
So can you clarify for us what type of litigation?
We are being sued primarily by applicants. We do have a cap in the City of Lansing for the retail side, and so as the applicants are denied, they are suing us. And then we're also currently the City of Lansing suing the state based on a deadline dispute and changes in the emergency rules. But we're also looking at, we're having threats come from community members, we're having threats come from patients based on perceived problems with our ordinance.
Like to make any of these.
I'll just be very brief. I mean, we've had the threat of litigation. That happens a lot. If someone is unhappy with a decision, we get the threat a lot. Unfortunately, we haven't faced those kinds of things in Portland, and maybe it is because there's no hard cap. I don't know if maybe that's the reason why, but it hasn't been an issue for us.
So part of the challenge in the city of Los Angeles is that prior to this new framework that we established, every single thing that we did related to cannabis, we got sued on. And we lost a lot of those suits in the past. So there were past policies where we had issued moratoriums, completely banned cannabis that was sued. So we expect litigation. We've done our best to try and create a framework that allows folks who feel as though they're aggrieved in some way by our process to be able to appeal decisions. So it's not just the Department of Cannabis Regulation that makes licensing decisions. We have a 5-member Cannabis Regulation Commission that will hear appeals. We have administrative hearing officers that can hear appeals. Because we have that process in place, folks actually have to follow that path before they would have standing to sue us. And I think we've been lucky thus far. We haven't issued a bunch of denials. It's taken us a while to process applications. So of the various phases of licensing that we've had thus far, I believe that we've only made determinations finding folks ineligible and sent out that to 6 different people. Or to 11 folks, and 6 folks have appealed. But the more folks that get denied, the more folks will appeal. And so we have a legal team that is completely dedicated to the department. I believe that one of my attorneys is in the room. I will point him out. Alex, can you raise your hand? So if you have, and this is what I always do when I go to meetings, I point everyone towards Alex and make them go talk to him. But if you're interested and concerned about litigation, I'd go talk to Alex Friedman in the corner.
Yeah, welcome to cannabis, I guess. It's true. Well, I think most of our litigation that we've seen has really been centered around our actions taken around enforcement of illegal residential cultivation. I expect that we may see some as we begin to possibly deny applications for one reason or another. But most of it's been really centered around the fines, fees, and penalties that we're assessing for illegal residential cultivation.
I would just like to add, I feel super lucky listening to what you guys are going through. The city of Las Vegas has not been sued, at least to my knowledge, and I can point out our city attorney is sitting back there, Brian Scott, if you want to ask him. But I think the main reason that we were lucky is that we specifically spelled out, I said we were super, super strict in our code, and we followed everything to a T. So if you were going to get a denial, you knew you were going to get a denial going into it. You had to do A through Z, and you had to submit A through Z, and you had to meet a specific criteria. If you didn't meet it, you didn't get licensed. We do make our applicants go through a background check investigation, and it's a full background investigation that takes months to complete. It's not the quick FBI report that our state does. I think our state got sued a lot, and because of that, it has shifted some of the licenses that were issued originally and then taken away and given to somebody else, because they had a ranking system in place, and in some cases they didn't follow exactly the rules that they laid out. So I just really think it's important that you set your criteria, you make sure that if you're going to issue a denial that you follow those specific reasons and don't deviate from that.
May I say one more piece on that? It's something that Kat said jogged my thinking in a text again from my colleague, Jeffrey. Thanks, Jeffrey. So when applicants do get a denial or an action taken against them, there's a lot of back and forth that happens at the staff level before that happens. There are warning letters that go out, emails, phone calls. We try really hard to not get to that point, but when it does, that decision is then reviewable by myself as the supervisor of the program. I look at that decision with fresh eyes, gather the facts, and then come back again. After that, the applicant can then go to the City of Portland's hearings office, again, reviewing the facts again, fresh eyes, and that's all before it ever hits the court system. So it is true that perhaps that's part of the reason why we haven't been faced with that.
So in Denver, I'll just be quick, we had one pretty major litigation related to pesticides because early on we took some action related to pesticides, and we got said we were accused of acting outside of the scope of our jurisdiction because the federal government regulates pesticides, as does the state. But in the end, our great lawyers, we navigated that and we were successful on that. We kind of argued we were standing in the gap, and we weren't trying to regulate the application or use. We were protecting public safety is kind of how I understood how that came down. We also do have authority to monitor and regulate storage of hazardous materials, and so pesticides were one of them. We were successful on that. Another threatened lawsuit was when we went to ban solvent-based hash oil extractions outside of a licensed facility. We did get that ban in place, but we were threatened by individuals who said they needed to make their own hash oil, they had their way to do it, and I think kind of our response to them is access to marijuana and access to hash oil and access to really anything you want in Denver related to marijuana is not a problem, and it's not safe to be extracting at home. So they never did sue us. But then, we do, every application we have comes in, just like Brandon says, we do a really significant due diligence. We do deny applicants. I don't know how regularly, but we are denying applicants, and when we do that, we have a great group of hearing officers who are here, and the hearing officers will hear those denials of the applications, whether it's due to proximity restrictions or what the other issue is, then it's appealed to me, and I'll make a decision, and very rarely does it go up to district court. We have had some, what we call a show cause, the Sweetleaf Case, if any of you all have followed that, where we had a business who was operating outside of the law. DPD conducted the investigation unknown to me. I'm not law enforcement, just a licensing agent. So they were conducting this undercover operation for a year, found out that Sweetleaf was violating criminal laws, and then took action against them. They've got the criminal case pending, but we were able to do the administrative case pretty quickly where we revoked their licenses. And then they appealed that, and that probably went through the process. Well, they did appeal it to the hearing officers and has gone through that process. So part of when we first started this, I would say in 2015, the city of Denver hired almost an additional 60 people to help with the regulation of marijuana, and that included quite a number of attorneys. Molly, do you remember the numbers? 7 or maybe 12 attorneys, and that includes maybe paralegals and support people. So, okay, next.
Jesse from the City of Edmonton Fire Department. So my question surrounds product shortage, or the possibility of that anyways. So we've only had the regulated market for about 2 weeks. We're already experiencing shortages. So I just wanted to know if your municipalities have experienced that as well, and how do you think that may have affected the regulated market and also the illicit market, and maybe what countermeasures you might have employed to fix that?
Yeah, I think that there were, the industry refers, and it's kind of sad that this is the case, but the industry refers to 2 dates that happened in California as mass extinction events. One being January 1st, when folks needed to have a license, and of course everyone didn't get a license on January 1st, so a lot of businesses weren't able to operate. And then July 1st, when we had the mandatory testing requirement come on board. And what we saw happen was somewhat of a shortage issue. The day before, weeks before the testing requirement came on board, we saw cannabis being sold out the door, $5 an eighth. Just kind of ridiculous prices, because folks knew that the very next day or the very next week, they weren't going to be able to sell those products anymore. What it meant was July 1st and July 2nd, there were considerably less products on the shelves, but because there were operators who were licensed, folks were able to get their products from somewhere. What we've had an issue of in the city of Los Angeles is because we licensed a bunch of we authorized a bunch of retailers first and didn't license our supply chain, is that we've essentially forced our operators to buy supply from other cities and municipalities. But there hasn't been a shortage of products on the shelves. They're just not local products, and so we're hoping to be able to change that.
It took maybe 2 months for the market to kind of correct itself, and it hasn't fully corrected. I mean, after that July 1, when products had to be tested, a whole bunch of products went away and have yet to come back. I think that market will correct itself over time, though.
Next question.
Hi, thanks for being here. My name is Melinda Keatinger, industry in Colorado. And my question revolves around environmental sustainability and how your different municipalities are dealing with issues such as best growing practices, cannabis waste specifically, and plastic recycling. There's been we've had some issues here of, well, can you recycle a plastic dram because it might have resin in it, and is that okay? Things like that. Thanks.
Would like to take that?
Okay. Well, in the city of Las Vegas, you can actually go to our website. We have an environmental officer that wrote up an environmental plan that anytime you open up a marijuana establishment in the city, you have to follow specific standards. And one of the standards is an environmental plan. And she did a lot of research and did a lot of back and forth and came up with this plan that everyone has to sort of follow. We don't have anything on the way of recycling, though, although I think that's a great idea to kind of go back and follow up with. But there is specifics on there on how to deal with the waste. They don't want you to just throw it into the trash can and somebody can go dumpster diving and take it out. So there's like I think it's like 50-50 grinding method. She does talk about composting and stuff, but if you go to our website, lasvegasnevada.gov, and go to our marijuana page, there is that write-up on there.
This is an area that I don't think that we're doing very well and in the city of Los Angeles, and so I'm interested as we move forward into the next calendar year for us to figure out what this looks like. A lot of our regulations, as they involve environmental sustainability, are really coming from state agencies. This is an area that we really haven't done a deep dive into, so if there are folks who have suggestions, we're open for those suggestions.
So in Denver, we have a sustainability work group that is really sort of organized and run by the Office of the Denver Department of Environmental Health. They'll be speaking at this conference. And what we sort of have led it and impaneled it, but it's a bunch of industry people. And they've got, I think, 3 pillars. They've done a lot of great work. They've got green business advising. It's purely advising type best practices stuff. And I think they released a best practices book about a couple of years ago, but I think they're about to update that and release another one, so there should be some good information in there. Okay.
Thanks for being here. My name is Alex Rubin. I'm the compliance officer with Craft Concentrates, a cannabis manufacturing company in Colorado. My question is regarding state, local, and municipal regulations on micro stands for security, alarm, permit usage, and monitoring of businesses from retail, manufacturing, and growers as well. One of the things that the industry is having a hard time with is regulations that come up on the municipal end and state level, and trying to dictate one or the other or both when new regulations come up. My question is what's the best way to go about mimicking either state law or municipal law when a new regulation comes up that might cost parts of the industry hundreds of thousands of dollars for a new security, new alarm system, certain permits that you might have for those businesses, and how to mimic either state law or city law for those regulations.
I think to the extent that the industry can identify exactly where those differences are between state and local law and pose the question to regulators, does this difference make sense? I think that that's helpful for us. Part of the challenge, though, is that as Brandon was saying previously, we can't do anything or create laws at a local level that go against what the state says, but I think that most of us have this expectation that we're going to have local control over what we do. So unfortunately for the industry, what that means is, though, if your mother told you that you could go to the store and your father told you that you couldn't, that means you can't go. So folks are trying to figure out what that means, and sometimes that's what that means.
And I guess I would also add, at the kind of micro level of this, there are standards that exist that local governments, can look to and lean on. All of our security plans need to be approved by someone who's qualified to write it, and we have a standard. That would be a security professional, and all the equipment that they install as part of that approved plan needs to be UL certified. There's other kind of listing agencies out there, like there's ISO for labs. So there are existing kind of standards out there that are already not even industry best practice, but just best practices as a whole for things like security.
So we have about 2 more minutes. Do we have any more questions? Are you guys ready to break for lunch? Oops, we have one more. Come on up.
So my name is Julianne, and my question revolves around the transition from medical marijuana to recreational, and specifically I'm from the state of Connecticut, a state that has a robust medical program. How did you see that cannibalized with the conversion to recreational, specifically with the number of patients or with producers or dispensaries transitioning to solely recreational due to the fact, primarily, that it is a less expensive product to be able to produce?
So for us, again, super lucky, in that the way that our ballot initiative was written, it only allowed for the first 18 months those who already had a medical marijuana establishment license to get the recreational license. So really, everyone who's gone through that program and was licensed were the only ones allowed, and are still the only ones allowed to hold the recreational license. That finally expires mid-November, so this month. And so we'll see how the new recreational people kind of come on and how that changes for us. But for us, it was a smooth transition.
And I think for us, the requirement to get a medical card that bar was so low already. I mean, it was 18 and have a pulse and a sore elbow, and so you could get the card. And so what we've seen is most people are just kind of dropping their card, and really the people that are utilizing that medical card are people that have legitimate medical issues and they want to buy those different products that are available that have higher dosages to them, or are between the ages of 18 and 20 with a pulse and a sore elbow.
In terms of the market itself, most of our medical folks did transition over and got every single license type, authorization type that they could for our adult use market. The one frustration that I have heard from medical patients, whether they're buying cannabis on the medical side or on the adult use side, is that because of taxes, new taxes are imposed. Folks are very concerned that they're not going to be able to continue with their same type of medical regimen because of the taxes that are new.
Can we just, I know we're out of time, but that's actually a very important topic, and we didn't really get on it, is taxation. In January 1st, a whole bunch of taxes went into place, and the number one person that we had a huge demographic leave the legal dispensary market in Sacramento, and they started buying in the illicit market because their cannabis was now 37% more expensive by the time you layer on all of the taxes.
And we will have a breakout session on that, so we can cover that in.
15 seconds. Oregon allowed medical dispensaries marijuana during that transition, and like Denver, Portland allowed medical dispensaries to get first bite at the apple to get licensed. So that's how we approached it.
All right, everyone, it's time for lunch. Thanks for being here. Thanks, our panel.